Welcome to our LGBTIQ plus Health Australia Policy and Research webinar. Today we're exploring strategies for working with Aboriginal and Torres Strait Islander LGBTQA plus young people, developed through the Walkern Katatdjin project. My name's James Zanotto. I'm the Policy and Research Communications Director here at LHA, and my pronouns are he, him. I'd like to begin by acknowledging the traditional owners of country throughout Australia, their diversities, their histories and knowledge, and their continuing connection to land and community. We pay our respects to all First Nations people, to anyone here present today in the webinar, and to their elders past, present and future. And I'd like to particularly acknowledge the Gundungurra people where I am here in the Southern Highlands of New South Wales. So today I have the chat function turned on, so I invite you to acknowledge traditional custodians where you are in the chat function if you'd like to do so. Before we hand over to our presenters, I'd like to do just a couple of housekeeping matters. I'd like to confirm we're being recorded today. So just be aware of that, and if you choose not to be recorded, you won't be appearing on screen, and the only opportunity will be through Q&A, and should be fine for anyone who'd prefer not to be recorded. If you miss any information, we'll have this on our website within a week or so, and you'll be able to go back and have another look. After the presentations, we'll have an opportunity for Q&A. So I invite you to put questions into the Q&A function. For most users of Zoom, that's across the bottom of your screen. When you hover it over, you'll see Q&A at the bottom. And finally, for housekeeping, if there's anything in today's webinar that raises concerns for you, there is support available, and you can contact QLife, which provides Australia-wide anonymous support for the LGBTIQ plus community. You can contact them on 1800 184 527 or visit qlife.org.au. So thanks again, everyone, for being here. Walkern Katatdjin is a national research project that aims to understand and promote the mental health and wellbeing of Aboriginal and Torres Strait Islander LGBTQA plus young people, and to work with developing appropriate interventions and responses. I'd like to very much welcome Shakara Liddelow-Hunt. Shakara's pronouns are they, she, who's a Wajari Yamachi. I really should have asked you, Shakari, how to pronounce that, so I'll leave it with you, who grew up on Noongar country. They're a PhD student and research assistant at the Telethon Kids Institute and the University of Western Australia, focused on the mental health and social and emotional well-being of Aboriginal and Torres Strait Islander LGBTQA plus young people. And I'd also like to welcome Mirella Wilson. Mirella's pronouns are she, her. Mirella's a cisgender bisexual PhD student who is interested in competency development for healthcare workers who support Aboriginal and Torres Strait Islander LGBTQA plus young people. Mirella has a background in organisational psychology, in training and development, and currently lives and works on Noongar country as a mental health practitioner with adult populations. On that note, very much Shakara and Mirella, welcome, and I'll pass over to you to put your presentation up and we'll get started.
Fabulous. Thank you so much for that. Let's get these slides going. Amazing. So Kaya, hello everyone. I'm Shakara. I'm a proud Wajiri Yamaji, and one of the researchers on the Walkern Katatdjin, or the Rainbow Knowledge Research Project. I can get these slides going. There we go. I would also like to start by acknowledging that I am on Noongar Whadjuk Whadja here in Bulu, or Perth, I can see that there's at least one other person joining from Bulu today. Pay respects to elders past and present, and extend that respect to the traditional custodians of the many lands that you're joining from today. And just acknowledge that we'll be presenting data and stories from mob from country across Australia. I'd also just like to quickly acknowledge our deadly artist, Sky Milton, whose work you'll see throughout the presentation. Sky is a young Yamaji Kuri person, incredibly talented young artist. Again, quick content warning, we'll be discussing suicide, psychological distress, mental ill health and experiences of discrimination. So as covered already, please do reach out if you're in need of help. The presentation will be covering research findings about Aboriginal and Torres Strait Islander LGBTQA+ young people's mental health and wellbeing, competencies for health and wellbeing services, working with Aboriginal and Torres Strait Islander LGBTQA+ young people. And I want to give a quick little look at a potential intergenerational yarning intervention specifically designed for this Aboriginal LGBTQA+ young mob. So, as mentioned, Walkern Katatdjin is a national research project looking at the mental health and wellbeing of Aboriginal and Torres Strait Islander, lesbian, gay, bisexual, trans, queer questioning, and asexual young people, and then looking at actually, with the data, how do we take the next steps towards supporting young people and working with services to develop appropriate interventions. It's a project that very much came out of a community identified need, in particular for data around suicide, which is something that more we're concerned about. We've been hearing from organisations like Black Rainbow from several years who've been lobbying for this data to be collected. So that's very much the context from which the research project has emerged. I'll be giving a quick overview of where Aboriginal and Torres Strait Islander LGBTQA+ young people are at currently, where their mental health and their wellbeing is at, and some of the context that they're bringing with them when they're presenting in health services, primarily by focusing on the results from the Walkern Katatdjin National Survey, which is a first of its kind survey looking at these young people's mental health across the country. But I do want to start off with some very brief qualitative findings that actually informed the development of the survey from interviews and focus groups done here in Bulu. So these were all topics that young people identified as being important to their wellbeing. I think for a lot of LGBTQ audiences, these will look pretty familiar, but for Aboriginal young people, there are some differences in how they play out. So for example, when we talk about community, yes, finding a queer community is important for a lot of young people, but also their place within the Aboriginal and Torres Strait Islander communities they already belong to, and particularly acknowledging that community and family can be that connection then to culture, to country, to these things that as Aboriginal people we've had to fight to maintain a connection to. So it gives a little bit of a different weight to it. Similarly, when we're talking about things like stigma or discrimination, it's that both cumulative and interacting effect of queerphobia, but also of racism that young people are then having to navigate their way through. Similarly, in those qualitative interviews, young people spoke a little bit about their experiences with services, in particular that they felt that there was nowhere that they could really go and receive care, or to just be seen for their whole selves as Aboriginal, as queer, as young, and that services weren't communicating to them that they would be safe to do that and present as the entirety of themselves. So instead, they were often feeling like they had to section off part of themselves and present as an Aboriginal person or present as a queer person, and that there was never just that space to be held in their entirety. Similarly, there was a quite interesting point around inclusion, not just as individual, but actually acknowledging the place that services have within the broader context of Australia, within their communities, within colonialism, and how services actually need to be really working with communities and empowering communities and not have a paternalistic relationship. So onto the national survey. It was a predominantly online survey across the country, launched in 2020, so in the wake of the pandemic. 619 Aboriginal and Torres Strait Islander LGBTQA plus young people aged 14 to 25 from across the country participated. It was approximately representative of Aboriginal young people across the country, a little bit of an underrepresentation from remote communities in the Northern Territory. And the majority of participants were actually under the age of 18. I think something like 60% of participants were 14 to 18 years old, predominantly women and non-binary people, and predominantly bi, pan, and gay and lesbian people participated in the survey. But it was very diverse. Young people have a lot of different identities and often multiple and interacting identities they told us a little bit about. We were interested in understanding wellbeing according to this social and emotional wellbeing model developed by Graham Gee et al., which is really commonly used in a lot of Aboriginal health services. It charts out people's wellbeing in terms of their connection to 7 different domains of body, mind and emotions, family and kinship, community, culture, country and land, and spirituality and ancestors. So we would say that if someone has really strong connection in one domain or in all of them, they're doing well, and understanding that in the context of the different social and historical and political determinants that we know impact upon Aboriginal people. Essentially what this did for us is that it points out some of young people's strengths. So for example, they were doing really well in terms of their connection to the LGBTQA plus community and the Aboriginal community. They really felt like they belonged there. And similarly, actually were really supported by their family, particularly their siblings, very accepted and supported by. But it also points to some areas that need more work. So connection to spirituality and ancestors, young people often didn't have that opportunity to engage with. And connection specifically to an Aboriginal LGBT community to actually meet and see other queer Black people and be held in that space. Again, this theme of being able to find that intersection and other people with those shared overlapping experiences. We looked at psychological distress as one of our mental health measures using a Kessler scale, which I'm sure everyone is familiar with, but it charts feelings of sadness or worry over the last 4 weeks. Generally, we would say that a higher score indicates a higher level of distress. And really concerningly, what we found was that over 90% of participants in the survey were sitting in this high or very high range, indicating that they were experiencing a lot of distress at the time that they were completing the survey. Similarly, what we saw was that nearly half of all participants had ever attempted suicide in their lifetime. It was about 19%, or 1 in 5, in the last 12 months alone, which is horrifying, and it really backs up the concerns from community that started the survey in the first place. So I think it speaks to the importance of actually listening to what community has to say. Young people are also experiencing frequent discrimination, so queerphobia within their Aboriginal and Torres Strait Islander communities, racism within the LGBTQA plus community, which are spaces that we want young people to feel safe and like they belonged. And they did indicate that, but that it was fraught. We also saw a small but significant number of young people who were experiencing racism in their romantic relationships and their dating life. And this in particular was actually strongly correlated with distress and with suicide, which is interesting. We know that for young people, relationships can be an important way of exploring their sexuality and their gender identity and having that affirmed, and is part of that developmental trajectory that they're on at this point in life. So I think that that came out as something that they were struggling with is a really interesting finding. Across the board, trans and gender diverse young people were doing considerably worse than their cisgender counterparts. They were nearly twice as likely to report a suicide attempt in their lifetime, reported higher psychological distress, struggled with multiple domains of well-being, so connection to culture, mind and emotion, body, and connection to family and kinship, were more likely to be experiencing discrimination within the Aboriginal and Torres Strait Islander community. And they also reported worse experiences with health services. And this is the final thing that I want to touch on, is that we did collect some data about young people's experiences in services. The first thing that we found was that 90%, the vast majority, were using general health services or mainstream health services, which I think really points to the importance of those mainstream services being inclusive. Across the board, approximately half of participants felt safe and respected at all service types, and many participants did discuss really positive experiences of feeling care, of feeling respected, and of feeling helped. However, services generally had a low level of knowledge about how to provide care for Aboriginal and Torres Strait Islander LGBTQA+ people, and there was a very clear need for staff to receive more training. At all service types, a significant number of participants heard rude or ignorant comments about their Aboriginality, about their LGBTQA+ identity, or both, which is pretty unacceptable that sort of overt discrimination was occurring. Specifically at Aboriginal community-controlled health organisations and general health services, there was a lack of visible signage that Aboriginal and Torres Strait Islander LGBTQA+ young people would be welcome. So things like pride flags, Aboriginal flags, signs on the door, inclusion policies weren't there, and it was really leaving that up to guesswork. In LGBTQA+ health services specifically, young people more reported that the signs were there and they felt welcome, but once they were in the front door, they were not receiving culturally competent care. And a concerning number of participants did report overtly racist experiences when trying to access LGBTQA+ health services. I do just want to wrap this little bit up by saying that it is not all bad. The young people who participated in the survey had some amazing things to say about themselves, that they enjoy just being able to be themselves unapologetically, that they felt like their sexuality and their gender identity were challenging colonial norms, that they had this different perspective because of the identities that they were inhabiting, and that the people they met, the connections they formed with the communities that they were part of was so important and so special to them. I'm going to hand it over to Mirella now to talk through some of the competencies and the findings from actually services perspective on caring for Aboriginal and Torres Strait Islander LGBTQA+ young people.
Thanks, Shakara. Hi everyone. My name is Mirella, and I am a PhD student at Murdoch University. I've been working on the project dubbed Training Health Providers to Work with Aboriginal and Torres Strait Islander LGBTQA+ Young People project. Like Shakara, I am reporting in from Bolu on Whadjuk Noongar country, and would like to pay respect to elders past, present, and emerging, particularly those that I was so fortunate to work with on this project, for their passion and wisdom and guidance. As Shak's kind of mentioned, there's been a big push from young people and services themselves to really increase service experience from First Nations queer young people in healthcare and wellbeing services. And Aboriginal and Torres Strait Islander community-controlled health organisations, or ATCHOs for short, are really the best positioned to provide culturally safe care to First Nations queer young people, and thus were a starting point for this particular project, which actually began around the same time as Walkern Katatdjin, and is greatly associated with Walkern Katatdjin, all the way back in 2021. So I'm going to talk a little bit about the project as a whole, because I think it really relates to some of the intervention going forward in this space, and also some of the key findings from this project, which not only relate to the type of training that people really want and are searching for, but also some core competencies for working with Aboriginal and Torres Strait Islander LGBTQA plus young people that we, I guess, developed together. So a little bit about the project. Like I said, it was born out of community need for really quality, inclusive practice type healthcare experiences. So just a bit of definition around inclusive practice that should be hopefully familiar is when organisations provide equitable care necessitating recognition and knowledge of of diversity to deliver equal outcomes for all service users. So this type of care is sensitive, informed, accessible, it's free from discrimination, and is culturally safe. So to create some training with this in mind for outros, we first ran a needs assessment looking at where inclusive practice is at, and we did and what the gaps in the training needs were. We did this through 2 focus groups with WA outros. We had intended to do more, but unfortunately COVID got in the way. But we did have 9 interviews with subject matter experts who were experts in Aboriginal and Torres Strait Islander LGBTQA plus health and wellbeing, either as service providers, as researchers and training experts, or as service users themselves. And these interviews were from metro, regional and remote areas, so across WA, Queensland, Northern Territory, South Australia, New South Wales. So we did that back in 2022. All that data, all that beautiful data is going into or went into some co-design workshops with ACHO staff members in Metro WA and Regional WA, and some co-design workshops with WA queer young First Nations young people themselves. And we're currently putting it together with the hope for later this year that we do a train the trainer delivery and evaluation. So it's a very exciting time. Shaq, can I have the next slide? Is that coming up?
Theoretically, yes.
Theoretically. Cool. Love it when tech is, there we go. Thank you, everyone. So some, bit far, there we go. Yep, okay. So just to give a bit of a very brief overview of the type of training which people really desired, some of the content that people wanted and that kind of thing that we got from that first big data set. The full report are available on the Walkern Katatdjin website. Highly recommend taking a look. But essentially people wanted some really sensitive, nuanced training that was very, very considerate of country that the training was delivered on, that was interactive, and really supported people who undertook the training to start developing connections, networks, and skills and knowledge. The knowledge that people wanted ranged from quite basic understanding of who Aboriginal and Torres Strait Islander LGBTQA plus people are, what their unique needs might be, some really good referral pathways for them, and what their history is. I want to point out that from the very get-go, there's a real need for that combined intersectional perspective rather than LGBT plus training with a small First Nations component or vice versa. People also really wanted some knowledge around how their organization could further embed inclusive practice, either through policy, data management systems, so not just individual kind of perspective. People also wanted not just knowledge, but also skills, so improving inclusive language use skills, communication and rapport building skills for working with young people, how to have really difficult conversations around sex, sexuality and gender with young people themselves and caregivers, and looking at critical self-reflection skills. So obviously the trainers or the training to provide the training needs to be really detailed and nuanced and sensitive. I'll go to the next slide. So kind of to sum up, we know that there was a real hunger, a real need from ATROs, from young people themselves, for a tailored, inclusive practice training that's widely available, that's created through that Aboriginal Torres Strait Islander LGBTQA+ perspective from the outset, that focuses not only on building awareness or changing attitudes, but also building inclusive practice and intersectional knowledge, skills, and behaviors, and training that is run in a really safe, supportive way. So to do number 4, again, we're running that train the trainer type process. But to do number 3, we decided to take a competency approach. So one of the key questions that was asked in this first phase was, what are the key skills, knowledge, behaviors, abilities, attitudes, and so on that are really required to work with First Nations queer young people? So I'm going to run through some of the findings from that now. The data analysis of the long interviews and focus groups was nicely distilled, I'm going to say, into 5 core themes. So those themes or those competencies are young person-centered care, effective communication and language, safety and visibility, non-judgment, and connected service. I'll give you a little bit to just take a look over the slide. It's a little bit detailed, and we'll go into some key behavioral and action items for how you may do this or how someone might start doing these things in their service. Just take a bit of a breather as well. Alrighty, I'll get you to move to the next slide. So with young person-centered care, we really want to prioritize empowered care where young people can be their whole selves. We want to focus on the young person's reason for attending service, do some shared decision-making, but also have some insight into who they are, what relevant health issues they might be facing, and what prevention activities might exist for them in the space. We're communicating with Aboriginal and Torres Strait Islander LGBTQA young people, showing that you're actively listening, being authentic, warm, welcoming, being curious and open, not defensive, using gender-neutral and inclusive language that's easy to understand, that meets people where they're at. Safety and visibility, not only promoting allyship through signs and symbols, but having relevant, up-to-date resources, hiring people who are Aboriginal and Torres Strait Islander LGBTQA+, mandating inclusivity training that is culturally appropriate and sensitive, and embedding policies and procedures relevant to inclusive practice throughout the organization. Non-judgment, it might be training in critical self-reflection, training in practicing empathy, and connected service is really about organizations reviewing what they have for training. Is it appropriate? Is it culturally safe? Are teams connecting with each other to talk about their inclusive practice activities? Are referral lists being maintained? Are relationships with local organizations, local ATROs being built? Are staff building their own networks of practice, keeping on top of their own professional development activities? So a lot of different types of behaviors, different types of skills, different types of required knowledge are really being drawn in here. I do want to preface this though. Shak, if you could go to the next slide. I really want to preface this by saying that the data that captured those core competencies was largely from, yes, there were the 9 interviews across the country, but largely from WA and WA Metro at that. And so when we're talking about building referral lists, for example, what works in Boolaroo probably doesn't work in Gadigal. They're going to be different specificities, that's a hard word to say, that need to be really thought out. So one way to do this is to put a lot of energy and effort, because it will so pay off, into co-design. So reaching out to your local orgs, your local outros, reaching out to your local LGBT plus orgs even, and starting that relationship building process. What can you learn from each other? Who are the local queer First Nation leaders? Who are the young Aboriginal and Torres Strait Islander LGBTQA plus young people in your area? What are their needs? What are they saying? Forming things like a youth advisory group can be so valuable for localizing this content. Next slide, please. Because again, what works in Wallu is going to be so different, and the unique needs for the area so tied to what is going on in country, what is going on in community. The referrals that are safe here will be very different over where you are. And so really taking a look at what is safe, what is necessary in our country, in our community, is just so important. I cannot stress it enough. It's also about taking a look inwards as well. Do you have signs of Aboriginal and Torres Strait Islander LGBTQA plus allyship about? What are your policies and procedures that underpin your inclusive practice? Are they protecting queer First Nations young people in your services? What inclusive practice training do you use? Does it come from that queer First Nations perspective? So a lot of learning around looking inwards, building relationships, but also prioritizing ongoing learning. Anyway, that's from me.
All right, so finally, I just wanted to give you a little taste of a potential intervention. Sorry, I can't talk today. A potential intervention that the team is working on that implements a lot of the principles that Mirella discussed. So this is Pride Yarns with Mob, which is an intergenerational yarning for Aboriginal and Torres Strait Islander LGBTQA plus young people, and support of elders, because we're running it here in Boolaroo with support of Noongar elders. It is actually based on a little pilot project that we ran in partnership with the Youth Pride Network, which, God, there was no funding, but it was just this piece that we were originally trying to develop TikToks and YouTube videos talking about inclusivity and how we can support queer young people and community. So you can actually go watch the little TikTok that we developed on the Walkern Katatdjin website or on Youth Pride Network's Instagram and their TikTok, I think. TikTok. But we were very lucky in that after we did this, the actual scripting process, we brought young people and we brought elders together to discuss, what do you want to talk about? How do you want to write these videos? And what content do you want to do? That time that they spent yarning with each other was actually, I think, more important than the videos that came out of it. It was such a valuable opportunity to bring queer young people and bring elders together and discuss these things that they maybe hadn't had the space to actually talk about before. So we were very lucky in that we received recently a Medical Research Future Fund grant to develop this up into an intervention, starting off by actually co-designing the intervention, meeting with elders, with other community leaders, with services, and of course with young people to discuss what they think is important, how we can get this intergenerational yarning to work for them. So like Mirella mentioned, co-design from the get-go. And then of course implementing the project, evaluating it, seeing actually, is this working? Does this make young people feel better? Does it make them feel more supported, more confident, stronger in their well-being? Which we'll be piloting in a couple of partner sites at Wandjina Aboriginal Corporation and Yorkern Healing Services. And then if it is successful, how do we translate that into other services, putting together this toolkit so that other people can pick it up and run with it? I think the real strength of Pride Yarns with Mob is that it's providing non-judgmental space led by the young people where they can come in and be seen for the entirety of who they are. Their blackness, their queerness. A lot of the young mob who participated in the pilot project were also neurodiverse or disabled, and they were really held in that as well. It gives them a chance to actually see that they are supported by elders and really explicitly hear that they're accepted and loved. And also just a chance to meet other queer Black young people, which for a lot of young mob doesn't happen that often. The actual success of the project really relies on strong facilitation. We were very lucky to be working with MJ Anderson Hyde over at Youth Pride Network, who's an amazing facilitator and really created a very safe space for everyone involved. It was a very slow and steady process of actually meeting with the young people first and letting them feel comfortable with each other and just get to know each other a bit, meeting with the elders and actually let them talk through and kind of orient themselves within the topic, and then slowly bring them together to start having those discussions safely. And we were able to do that because we already had these relationships with elders. The research team knew them personally as Aboriginal people who exist within this community. We'd worked with them on the Walkern Katatdjin project for a couple of years now. But having that in-community knowledge and those relationships already built was really fundamental to actually getting this off the ground. Like I said, running in partnership with the Youth Pride Network, with Wanching, with Yorgum, so having those strong relationships already built. So we're really excited to see how that goes. We'll report back in 2 years, I hope, and let you know if that is actually a successful intervention that can work for Aboriginal and Torres Strait Islander LGBTQA+ young people. I do, just as I'm wrapping up, want to acknowledge the project's governance committee and our youth advisory group, and also our project partners and supporters, all of these organisations on the screen who have just been so invaluable for the guidance that they've given to the project. And of course, acknowledge our research teams and all of our ethics and funding. And thank you so much for listening today. I think we're going to answer some questions now.
Thanks, everyone.
Thanks so much, Mirella and Shakara. A lot of information there and a lot of content. If I could take the opportunity on the first question, as I invite people to add any questions they have into the Q&A chat. So much content there, we've probably run a little bit over time in the presentation and won't have much time for questions. What I'm keen to ask and to add in, if you could, I hope that webinars like this will help get some of the information out and start to build up some of the training. But I'm really interested to know if you're thinking about how the information can be shared nationally and how we can start to embed it into training for relevant services across Australia.
Please code blue, level 1, ward 1.
So Mirella, are you going first? I'm not sure how other people found that, but the audio wasn't great in that response just then.
So sorry, I'm based in a hospital and we're getting code blues through the emergency system. Not a worry, I'm going to let Mirella answer that one as the training expert.
Yeah, so the data from the needs assessment is widely available or freely available on the Walkern Katatdjin site. So there's that in terms of distributing some of the findings. In terms of the training itself, it's made for ATROs, and it will be available and purely developed when developed a little bit more formally, I guess, for ATROs to access through a training hub online. So people will be able to use this. We'll operate it in that train the trainer kind of space, and it will be free for ATROs. In terms of other people taking the learnings from the studies, again, we'll be writing all of the stuff up into distributable reports, training package reports, and that kind of thing, with some action items and recommendations and so forth and so on. And I imagine that will come out this year for phase 2, which is very exciting. But phase 1, like I say, is already available through Health InfoNet, through our website, and so on. Did that answer the question? I hope it did.
And just in terms of the Walkern Katatdjin survey findings, those are all available on our website, rainbowknowledge.org.
There we go. That's better.
In a full report, there's also a recorded presentation of findings and the report of all the qualitative findings. So those are there, and we're really keen for people to access them and share them widely. We're always happy to come and present and have conversations with people. We're really keen to get this taken up really broadly across our LGBT services and our Aboriginal services and our mainstream services, and just hitting all of those different points that queer young people are engaging with.
Thank you. At this point, we don't have any questions. I am seeing a few comments coming up in the chat. Distributable reports and resources would be really helpful. And so, Shakara, you've in part responded to that in terms of the information that's available. The thing that really always gets me is the absolute basics of human interaction that have to be included in training. Listen to, understand, ask open-ended questions instead of assume mutual vulnerability and treating their lived experience to be the expert. I think I have to agree in many ways. As I listened to what you were saying, I thought so much of this is obvious, but it's so wonderful to have it articulated in a way that is systematic and research-based.
I think
So-
the people in the chat are kind of absolutely correct in saying that, you know, there's a potentially basics of human interaction, or in terms of a lot of the models that maybe have come before, but I wonder if it is feeling yep, I've got it, yep, I'm doing it right, versus doing critical reflection on what else do I need to know, what else could I be doing. So kind of coming back and doing self-assessment, organizational assessment, seeing, you know, where am I actually at.
Yep.
But definitely that sense of just seeing people and building relationships, I do remember, was something that so many people kept talking about. It's just so foundational. Just to touch on the point about resources, also on the Walkern Katatdjin site, which I'm going to keep promoting, there is a resources page. So we've developed some specific stuff around how to yarn with young queer people, for services, but also for family members and community. I know we've put together lists of like Aboriginal queer artists and musicians and influencers, which is something young people said was important to be able to see that. We put some resources together for the last election about how to support young people through that and through the referendum and getting your name updated on the electoral roll and finding support through all of those sorts of things. So definitely something worth checking out.
I think as well there's a key takeaway document from the needs assessment report up there too, which again distills a lot of the information from the big reports. So
Wonderful. Thank you both again. We've got comments, but we don't actually have any questions at this stage. I have to say that's incredibly unusual in our webinars. So I'll put it down to you, Mirella and Shakara, that you've explained it extremely well and given us some wonderful information and content. So thank you. We're now pretty much on time. So we will wind up. We do have a brief feedback survey that I'd welcome any comments, and I put that into the chat a few moments ago. You should also get the information when you log off. And a final reminder, if anything has raised issues from you, QLife is available from 3 p.m. today on 1800 184 527 or visit qlife.org.au. So a great final thank you. Thank you to everyone who's participated this afternoon. Have a great day, and we'll see you at our next webinar in a fortnight's time, where we'll be reflecting on some extraordinary policy and practice that is occurring in Tasmania at the moment. Thank you again. Bye, everyone.